I see a difference between guilt and shame. And I'm going to start our conversation by trying to lay out for you what I think some of those differences are. And I invite you just to have an open mind about that possibility. There are definitely clinicians and presenters who kind of talk about guilt and shame very synonymously, almost interchangeably. And I'm going to try to make a case for why I think actually they are different. Um, and I think many clients hold both and, can lead from both and operate from both. I'm even going to suggest I think that shame is more tenacious. It's a little bit, or maybe a lot more challenging clinically for us to work with and to help our clients to heal from. And I'll talk about why that is as well. I'm going to walk you through some of the more common reasons why I think our clients come with feelings of guilt and shame. And I'm going to talk about what I think is in and of itself a very important and effective intervention, and that is psychoeducation. And I think the more that we can educate our clients and normalize for our clients some of the inevitable sequela of having been traumatized or abused, I think that also begins to alleviate some of the guilt and the shame that they may be holding. I'm going to talk about the value of incorporating both curiosity and self-compassion, because I think those things also go a very long way towards mitigating, particularly the feelings of shame that our clients hold.